Hey, what's up, people? Today on the platform of Lively Healthcare, we're going to launch a program where we will be talking about the health education and health safety tips. We have a healthcare professional with us, a nurse, Mr. Nawaz Ahmed. So, could you please, Mr. Nawaz Ahmed, highlight us some safety and health tips? You know that we have a lot of aged population around us, and at the same time, the people who are watching us around the world. So, could you just help us because there are skin infection problems? Could you please advise us?
Well, I can give you few tips. So first of all, we have to learn what is a health. So health is a combination of mental, emotional, social, and physical health. So many people don't consider a mental health as a big thing, but the mental health is the basic a big thing. So how you can be a mentally healthful and how your body is healthy. So what I would say as a community nurse, I would explain there's a lot of infection around us. Still, even most of people think we passed the COVID and stuff like that. But as a nurse, I could tell you that there's a lot of infection going on around us, and people are so relaxed nowadays. And I would suggest the first tip is that just keep wear a mask.
I see.
This is worth it to wearing on the public places. Infection is all around there, especially in the elderly population. Elderly population is more vulnerable than the younger people.
I see.
And that is it's a real for me because as a nurse I can see. So people are still suffering from that disease, and there's a lot of every day. If you go to the Health Canada websites, you will see that every day the breaks down in the retirement home, in the long-term care home, especially the elderly people. So my first tip for your channel and your platform would be hand hygiene, wear a mask whenever you go to the public place, and this is worth to wear it, believe me.
I see. And I also see that the hand sanitizers are getting disappeared from the counters.
Yeah.
So you think that we should carry a hand sanitizer?
Yes, unfortunately, because unconsciously we as a human being, we touch our face many times in a day. Even we don't realize that we touch that much time into our faces. So it's worth it whenever you go for the shopping, grocery, or go outside and touch anything, object. It's still worth it that keep hand sanitizer your hand, and this is a really really helpful to prevent infection and make a community healthy.
And there are a few common practices in the community. We always see that one thing is very common, that people are started to wear the fashion masks, which are actually possibly not the medical mask. They are just getting it from the designers, and they start using it. Do you think they are preventable?
Well, it's like it's a debatable. So people just still people just keep talking. In my personal perspective, it's better than nothing. If you are able to wash it, if you can keep clean your own mask, that's okay. But if you have a surgical mask that's really that's made for that,
I see.
And just use it and throw it away, because you don't want to carry those pathogens to your home. And for example, you are wearing mask outside, now the pathogen on your mask, and now you came down, you just hang it or put it somewhere. So basically those pathogens take 24 hours, some of them more, to just die down by themselves.
Yeah, that was my next question. Can you reuse that mask every time?
So that's the if you can keep it safe, and if you can keep it clean, and you're good to wash it and clean it correctly with hot water and stuff, and then you can always use. But the best practice is a surgical mask, I would say. And disposable mask.
I see.
So I would say that if you're wearing something is outside, you should be leave before enter the bedroom or the home.
And let's see, you know that mostly we live in Canada, and there are, I believe, a big number of population has already got vaccinated. So what do you think that people who had, let's say, 3 vaccinations, they feel that that's safe and they're not going to get infected? So what do you think that people still can get infected?
No, I witness actually. I witness many people have the 3 dose, 4 dose. They still got COVID.
I see.
Its intensity is basically a little bit less. It might not be detrimental, but still you can get infection, COVID infection, no matter you have 3 doses or 4 doses.
I see.
But I would say this is the best practice to just keep yourself safe by masking, by hand washing, and hand sanitizing.
Okay. Yeah, there's one more very common question now. It's possibly a myth, a misconception. People do feel that once you have COVID-19 and now you got cured, and after this, some people think that they possibly are immune to the COVID-19. Do you think it is true?
Well, that's not true, because every time the COVID hit you, your immune system is making more antibody, but still you're not prone to COVID or any infection. Okay. This is just myth.
I see.
So it's called reoccurring.
Okay.
So I saw many patients reoccurring COVID. So it was not that intensity is not that bad, but still you can get positive for the COVID anytime, even you are vaccinated. So this is just a myth. That you are vaccinated and you are safe. No.
I see.
So you can be still, even you're not symptomatic, you can be a carrier, you can be asymptomatic, you can be asymptomatic, and still in both stages you can be a carrier.
I see.
For those viruses.
I see. And how many days do you think that you are carrier if you got infected?
So if you are it's a best practice. It was used to 10 days, 14 days.
Okay.
Now it just depend on the facility. The guideline and protocols are. But I would, as a nurse, I would say if you can have a 7 or 10 days.
Okay.
Just if you are traveling somewhere, just be a 10, 14 days apart to get to your work or do the social stuff.
Yeah.
This is a safe.
Yeah. Okay. Now there's a very common practice as the people go dine out. Do you think if you are going into a busy restaurant, and of course restaurants are full with the patronage, and
I would say that just follow the Canada Health Guideline.
I see.
That is still there.
I see.
That is still recommendation there. So I would say follow them. So 3 meter apart is the best practice at this time. They're advising. So just be a 3 meter apart.
I see.
Because when we talk, we don't see with the naked eye that we can transfer, and if we are, for example, if we are asymptomatic, we don't know if we have some infection, but we can still transfer to the other people, right?
Yeah.
With the talking and your saliva. So it's a better practice. Just be apart and wear mask if you're not eating.
Okay.
And if you're done eating, wear mask. That doesn't hurt.
Good. Yeah. Okay. Now there's one more question coming in. It is generally that when somebody starts feeling sick, start feeling somehow influenza or maybe coughing, and you have taken a antigen test and your test is actually negative. So do you think there is still possibility that you're still infected if the antigen test is not showing that you're positive?
Yeah, because if you start symptom, so it's an incubation period for about 5 days. Even you're negative today, you can be a positive within 5 days.
I see.
So when you start feeling your sore throats or chill or any symptom of COVID-like symptom, any noisy, like a running nose or watery eyes or stuff like that. So it's a very, very difficult that to determine distinguish between the COVID and the other influenza. But still you have to be mindful that it can be COVID and it can become positive within a few days. So just keep eye on that, and I would say just inform your work or your screening. If you're not passing screening, you should not go to work for 5-7 days at least.
I see.
Yeah.
Thank you very much, Mr. Nawaz. So I think we have concluded the first session. Thank you so much.
Perfect. Thank you very much. Appreciate, and thank you for inviting me, and we'll be here to help you. And at the end, I would say, this is your health. Just keep charge of your health, because at the end, you are the person who is going to take care of your own health and take your health in your own hand.